Bonjour.
Good afternoon. Thank you for joining us today.
By expressing my profound shock and sorrow at the events yesterday off the coast of Greece, where Canadians were serving as part of NATO Operation Reassurance. Let me say to the women and men of the Canadian Armed Forces, your colleagues were heroes who fell in the line of duty, protecting Canadians, protecting Canada, protecting our allies, and protecting freedom. My heart goes out to their families, to their loved ones, to their friends, and to fellow members of the Canadian Armed Forces. All of Canada is with you in your grief. Permettez-moi d'abord.
Allow me first to express my deep sorrow with respect to the events that took place off the coast of Greece, where there were Canadians taking part in Operation Reassurance. I would like to say to the men and women of the Canadian Armed Forces that your crew members were heroes who lost their life in the line of duty protecting Canada. I am wholeheartedly with their family and their friends and their crew members in the Canadian Armed Forces. Our thoughts go out to all of you, as do the thoughts of all of Canadians.
From Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, Dr. Howard New, the Minister of Indigenous Services, Mark Miller, et le Président du Conseil.
And the President of the Treasury Board, Mr. Jean-Yves Duclos.
So is Indigenous Service Canada's Chief Medical Officer of Public Health, Dr. Tom Wong. He's available to answer questions as well. Dr. Tam, please.
Hello, everyone, and bonjour à toutes et à tous.
Good afternoon, everyone.
As usual, I'll start with the latest numbers on the COVID-19 in Canada. 52,057 confirmed cases, including the first case in Nunavut. There are now 3,082 deaths. To date, labs across Canada have tested over 800,000 people for COVID-19, with about 7% of these testing positive. This week, things have been a little flat. COVID curve flat, that is, and that's got us all quite excited about what that means for getting out of our houses. Though, as I have said before, we have to be very cautious going down the other side of the epidemic curve. It would be a whole lot easier if this was a well-trodden path, with many who have gone before us. But we are largely new explorers, so we'll need to curb our enthusiasm and tighten the safety ropes for the way down. Already on this path, we've seen some worrisome transmission events emerging. Having learned a lesson about vulnerabilities in long-term care homes, we're now tackling introductions and spread in certain work settings and congregate housing. I am also concerned about increasing numbers of COVID-19 in First Nations communities in several provinces. We must get ahead of things to protect and support these communities, ramping up testing and contact tracing to find where chains of transmission are occurring. And while we make our way down the mountain together, I remain encouraged by the patience, cooperation and kindness of Canadians who are making the path easier wherever they are needed. To raise our spirits and keep us going, I'd like to share a couple of the many inspiring examples of Canadians who are joining the call for volunteers. Some are helping to get needed supplies to the front lines, while others are joining the front lines themselves, where possible, to help those in need. Many of these efforts have started as grassroots initiatives by everyday Canadians using their skills, creativity, ingenuity, and generosity to help in any way they can. A great example is Conquer COVID, that began like the little engine that could in one family's home in Markham, Ontario, until it picked up steam from two of Canada's big names, Olympian and hockey legend Hayley Wickenheiser and actor Ryan Reynolds. They joined forces with Conquer COVID out of a shared goal to provide PPE for our healthcare workers. Another Olympian, Joanne Rochette, have just received her medical degree last week, is now heading straight to work to help in long-term care homes in Quebec as they bear the brunt of this epidemic. These Canadians exemplify what it takes to get down this mountain, the precision and grit of an Olympian with a can-do attitude and a readiness to help others. To all Canadians who are helping in innumerable ways, thank you. Merci.
Okay. Thank you, Dr. Tam. Et maintenant, je donne
Now I give the floor to Mr. Howard New. Thank you and good afternoon. As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 52,057 confirmed cases, including the first case in Nunavut. There are also 3,082 deaths. To date, labs across Canada have tested over 800,000 people for COVID-19, with about 7% of these testing positive. This week, things have been a little flat, just like the COVID-19 curve. And that's got us all quite excited about what this means for getting out of our houses. Though, as I've already said before, we have to be very cautious going down the side of the epidemic curve. It would be a whole lot easier if this was a well-trodden path, with many who have gone before us. But we are largely new explorers, so we'll need to curb our enthusiasm and tighten the safety ropes for the way down. Already on this path, we've seen worrisome transmission events emerging. Having learned a lesson about vulnerabilities in long-term care homes, we're now tackling introductions and spread in certain work settings and congregate housing. I'm also concerned about increasing numbers of COVID-19 in First Nations communities in several provinces. We must get ahead of things to protect and support these communities, ramp up testing and contact tracing to find where chains of transmission are occurring. And while we make our own way down this mountain together, I remain encouraged by the patience, cooperation, and kindness of Canadians who are making the path easier whenever they are needed. To raise our spirits and keep us going, I'd like to share a couple of the many inspiring examples of Canadians who are joining the call for volunteers. Some are helping to get needed supplies to the front lines, while others are joining the front lines themselves where possible to help those in need. Many of these efforts have started as grassroots initiatives by everyday Canadians using their skills, creativity, ingenuity, and generosity to help in any way they can. A great example is Conquer COVID, that began like the little engine that could in one family's home in Markham, Ontario, until it picked up steam from two of Canada's big names. Olympian and hockey legend Hayley Wickenheiser and actor Ryan Reynolds joined forces with Conquer COVID out of a shared goal to provide PPE for our healthcare workers. Another Olympian, Joni Rochette, having just received her medical degree last week, is now heading straight to work to help in long-term care homes in Quebec as they bear the brunt of this epidemic. These Canadians exemplify what it takes to get down this mountain. The precision and the grit of an Olympian with a can-do attitude and a readiness to help others. To all the Canadians who are helping in innumerable ways, we thank you.
Okay. Merci, Dr. Knu.
Thank you very much, Dr. New.
From our Minister of Indigenous Services, Mark Miller. Mark, please.
Kwe Tanse Ulukut Sego. Good afternoon. Bonjour.
Good afternoon.
As of April 29th, there have been 129 COVID-19 cases in First Nation communities on reserve and 16 confirmed cases in Nunavut's Inuit communities. As stated by Drs. Tam and New, this morning brings confirmation of the first COVID-19 case in Pond Inlet, Nunavut. With the community and the territorial government, we will be giving this our full attention to ensure appropriate contact tracing and maximum containment efforts are undertaken. To date, over $690 million in funding has been directly allocated by Indigenous services towards the health response to COVID-19. This includes activities undertaken directly by the department, such as procurement of supplies and nursing services, as well as the preparedness measures being undertaken by communities. Services aux Autochtones Canada.
Indigenous Services Canada continues and will continue to keep individual safety equipment for First Nations and supplies. This is for healthcare professionals who are taking care of patients sick with COVID-19. To date, we have sent several orders of PPE and surgical masks across the country. We want to support them during this pandemic, and we continue to rapidly respond to demand within 24 hours.
Pandemic is impacting Indigenous communities in many ways. Whether there are cases or not, or close to their communities, people find themselves experiencing distress, anxiety, and uncertainty. This is particularly the case for people who are at higher risk or the family members of those who are at high risk. These are real and understandable reactions, and there are mental wellness supports available to help. It's important to underscore that many communities and service providers are adapting their operations to respect the requirement for physical distancing, and they should continue to do so. For example, in our case, we have increased the number of crisis intervention counselors on shift at the Hope for Wellness helpline, which is now receiving more than 100 calls and chats a week linked to COVID-19. The Hope for Wellness helpline is available to provide immediate, culturally safe, telephone crisis intervention support for First Nations, Inuit, and Métis 24 hours a day, 7 days a week, and the number is 1-855-242-3310. The online chat is hopeforwellness.ca in English and in French, and upon request in Cree, Ojibwe, and Inuktitut. Le financement a été...
The funding was paid to the Indigenous Community Fund, $1 million for urban populations. As previously announced, additional funding was also sent to support shelters that offer essential support to women and children that are fleeing violence on the reserves. We've announced support for Indigenous communities and for post-secondary students. I would like to say that more support will be necessary, and we will continue to work with communities at every step of the process to ensure that we meet their needs.
No surprise to anyone who knows someone that has worn the uniform that today our nation grieves, and in the face of uncertainty, the members of the Canadian Armed Forces are stepping up to help those most in need. These are people that are prepared to make the ultimate sacrifice for Canada, and that is just a small window into the character of these people. Across the country, we have seen Rangers and Canadian Armed Forces members stand up and step up where Canadians need it most. In our long-term care facilities, in areas with acute resource needs, and in remote areas of the country. They've done this unfailingly and with a level of grace and professionalism that we've come to expect from the Canadian Armed Forces. And today they do so, most certainly, with heavy hearts. Nous comprenons que les personnes...
We understand that seniors in long-term care homes are particularly vulnerable to this virus, and their health and safety are our utmost priority. We are deeply concerned by the spread of this virus across the country, and we recognize the tragic events that took place in Quebec long-term care homes. That is why we've provided support to these institutions that are affected by COVID-19, thanks to the use of the Canadian Armed Forces, the Red Cross, and Health Canada volunteers. Resources have been mobilized to help Quebec get through this. We always do this when an emergency situation threatens our citizens. The Canadian Armed Forces do everything they can to help those who are in need. To date, roughly 500 medical personnel and CAF support members in long-term care homes in Quebec. This will help doctors and nurses locally to ensure that they can manage patients and provide health care to those who are in long-term care facilities. We will also help with the coordination of nursing and logistics need and provide individual protection for those who work in long-term care homes. Moreover, roughly 160 Canadian Rangers employed in Basse-Côte-Nord and Nunavik will provide general and logistical support locally by creating mobile clinics and by guiding the local population.
Be to work in partnership with First Nations, Inuit, and Métis, and as provinces, territories, and cities start discussing the eventual easing of restrictions, we will continue to be extremely vigilant. By working together, we're flattening the curve, and we'll continue this together with work in all communities, secure in the knowledge that we will all keep our fellow citizens safe. By working together, we're saving lives. Miigwech, Nakumik, thank you, merci.
Thank you.
Okay, thank you, Mark. Et maintenant, je donne...
Now, I give the floor to the President of the Treasury Board, Mr. Duclos. Thank you, Christia. Good afternoon, everyone. I would like to also say that our hearts go out to the families and friends of the victims of the terrible crash of the helicopter that took place in the Mediterranean Sea. And like the Deputy Prime Minister said, our thoughts are with you during this very difficult and painful time. Talking about commitment at the Canadian Armed Forces, I would employment and the work of the CHF in long-term care homes in Quebec, where there's also a tragic situation that affects thousands of vulnerable seniors. And 125 medical technicians were deployed in 5 care homes after the request that the Quebec government made on April 23rd. In recent days, we have seen the deployment of 320 other members of the Canadian Armed Forces in 8 long-term traditional care homes, a total of nearly 500 members in total, and roughly 550 soon. We also expect the deployment of many Canadian Armed Forces in 7 other long-term care homes in Quebec, and this will give us the opportunity to thank the members of the CAF and also the members of various institutions and long-term care homes for their very strong work that is highly appreciated. And we also like to thank the representatives and the officials of all levels of government that allow us to cooperate together to provide services and to support seniors who so need this care. Thank you. Thank you, Jean-Yves. We're now ready to answer your questions.
The Prime Minister, so as usual, we'll start on the phone with 3 questions, 1 question, 1 follow-up. Operator.
Thank you. Merci. The first question is from Emily Bergeron from Agence QMI. La première question de Emily Bergeron de l'agence QMI. Your line is open. Votre ligne est ouverte.
Oui, bonjour.
Hello. My question is for Mr. Duclos. It is about the assistance provided by the Canadian Armed Forces in long-term care homes. You've said that there will be care provided to 8 new care homes. Can we get an idea of which long-term care homes you're talking about and how many personnel will be sent per institution and what will be done exactly? Answer. Thank you very much for your question. Yes, there are 8 numbers, so there are 125 members that were deployed, 8 additional long-term care homes that received members for a total of between 550 members that will be deployed very soon in these care homes. There are some members that are already there, and we expect the deployment to be completed by May 11th. Roughly, their medical technicians and support staff to support the medical personnel. And there's also other support for other tasks that are necessary in long-term care homes. And there are variable needs, and they also are changing. And this is always done under the leadership of the government of Quebec and in cooperation with the Quebec government. In terms of the number of the long-term care homes, this will be the names rather. This will be communicated very shortly and separately. Follow-up question? Thank you. In terms of these teams of personnel, you've mentioned nurses, medical technicians. How many military personnel have training in medicine versus those who aren't trained, who are just there to serve meals, for example? Answer, in terms of that, that's more technical on the health side, and I will give the floor to Dr. New. However, what I can tell you generally is that there's a key balance between medical responsibilities and support responsibilities to other types of services. We're talking here about taking care of sick people. So we do have to have medical personnel, and they also have to provide meals, do certain personal care activities, clean the material that's being used. They have to take care of the environment and the facilities, take care of the movement and of personnel, and make sure they have the necessary equipment for these long-term care homes. So the Kingdom Armed Forces are well equipped to do these activities. And we do recognize that what tasks are done depends on the long-term care homes in question. I don't have much to add to what Mr. Duclos has just said. Yes, the Canadian Armed Forces, with their personnel, obviously have the necessary skills. The needs are changing, and we're working in cooperation with the Quebec government and for these long-term care facilities. We have to examine what the needs are, and we will better understand what every person can do. In terms of doctors, there may be skills for them, activities that meet their qualifications, but the situation is evolving, and we'll have more details in coming days.
Next question, please.
Thank you. The next question is from Ryan Tumilty from National Post. Your line is open. You may proceed with your question.
Yeah, hi there. I'm asking today about the commercial rent subsidy program that the government's announced. Hearing a lot of concerns from businesses that they have to show a 70% reduction in revenue as compared to the 30% reduction in revenue for the wage subsidy. I'm wondering why this 70% threshold was set.
Well, thank you for the question. As it is important to be reminded of, this is part of a broad package to support the economy and, most importantly, our workers through this very difficult situation. So these measures are emergency measures. They are there to help businesses and workers in their specific circumstances. As is the case with other measures, there are criteria. We can allocate the resources to those that are most in need. These criteria both take into account the importance of the needs, but the ability of the federal government to be helpful in a manner which is complementary to the work of provinces and territories. Because in this particular context, as you well know, the agreements were necessary and important in order to implement the program, because regulations around rent, regulations around the operation of the relationships between owners and renters, that's all guided and enforced by provinces and territories. So that's why those rules were designed with provinces and territories and will be implemented in collaboration and in support to provinces and territories.
Follow up.
Yeah, so are you saying that there was resistance when you were negotiating with the provinces of setting the revenue drop at the same level as the wage subsidy? And I guess also as part of the program, commercial landlords have to have a mortgage outstanding to qualify for the program. I'm wondering about why that provision is part of the package.
So briefly, two things. First, indeed, we came to a quick agreement with provinces and territories on the best way to join forces and implement support to businesses, and small businesses in particular, in the context of the very severe pressures that they are facing in the crisis. And second, that ongoing work will require the collaboration of the banking sector because it's been identified as key in support to owners and renters, and that's why those specific parameters were specified in both the agreement and the announcement.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. La prochaine question est de Lina Dib de la Presse canadienne. Votre ligne est ouverte. Vous pouvez poser votre question.
Oui, merci.
Question. Good afternoon, Mr. Duclos. I'd like to talk to you about the CERB. Your government reached an agreement with the opposition yesterday to do certain things for students and make some adjustments. Will there be a delay in the implementation of the CERB for students? Answer. Thank you for reminding everyone that we were able to work effectively with the opposition parties yesterday. What we saw yesterday was that all parties realized the importance of helping our students. I was a teacher for many years, and I was also a student myself before that, and I know how an economic crisis can have very serious effects on students, not only during the time when they study, because often they'll wonder if it's worth continuing their studies, which is a serious situation for them and also for our society as a whole, but also when they get out of their studies, when they want to take on a job, the economic crisis could have a negative impact on them, even in the very longer term. So yesterday's results were very important. The Senate, if I understand correctly, will soon ratify this legislation, and this will bring us to the next step. We're all aware that the next step will happen quickly, namely the implementation of the system that will allow students to receive the CERB, and we've seen how much we can count on the skills and commitments of the public servants in Canada to rapidly implement this program for students. And there are 7 million recipients of the CERB, and many Canadians that were skeptical about our ability to offer such a sizable assistance program so quickly, well, they've now seen that we're able to do this. A follow-up, Mr. Duclos. My question was about the regulations that you'll have to adjust. Will that delay the implementation of the CERB? And do you have a figure about the number of requests for wage subsidies from companies? And do you see this as an indication that people are away from the CERB and asking for the wage subsidy? Well, you've asked a lot of very good questions. It's hard to answer all the questions that are asked. In terms of the regulations, the new specifications that were made yesterday will allow us to rapidly incorporate regulations to implement the CERB for students. And in terms of your question, repeat it once again, please. Could you repeat your question, please? You had 3 other questions, I think. They were all connected to each other. Yes, the number of companies asking for the wage subsidy. Unfortunately, I can't give you an answer about that. I think it was about 60,000 yesterday, if I remember correctly. but we expect this number to continue to rise because there's a great need for the wage subsidy. And as you know, we have to ensure that companies can continue to pay their workers so that workers can continue to be available for the economy when it starts up again. Thank you very much, Minister. We'll take a question from the room.
Guess we'll start with Ashley from CBC.
It's actually Annie Bergeron-Oliver from CTV. That's okay, though. We're both blonde. My first question is to Dr. Tam. Yesterday, the City of Ottawa told families to stop visiting their loved ones through the windows at the 4 city-run seniors' homes. I'm wondering if this directive is taking physical distancing measures too far, or if this is something you support.
Well, I know that the Medical Office of Health in Ottawa is very much engaged with her community, so I don't know the specifics of this setup, but I think that question is best left to her. But of course, I certainly recognize how difficult it is for families not to be able to see their loved ones in these in the long-term care homes. So I think our collective advice is to just do that safely.
Okay, and second question. A second Canadian healthcare worker, a PSW from Peel, has died as a direct result of COVID-19. Her union says that too many frontline workers, especially PSWs, do not have adequate access to protective equipment, and they don't have the necessary protections in place to keep them safe. What do you say to workers who feel that governments at various different levels are not protecting them adequately? And are you aware of any provinces or municipalities who are facing any direct shortages right now of PPE?
Well, I know that our teams are working, every day to look and forecast any needs from the different provinces and territories, so that PPE can be allocated. I think I can't comment on the specific distribution down to the front line, but I know that for sure all chief medical officers and their recommendations that we have to protect our frontline workers and the personal support workers at the long-term care homes. We provided some guidance to that effect as well, which includes the protection in terms of masks, for example, for the whole shift or the whole time that someone is working in those settings.
Good morning, Tonda McCharles, Toronto Star. Dr. Tam, can you talk a bit? There's some anecdotal evidence in the U.S. about some positive results coming out of their trials with convalescent plasma, and I'd like to hear you talk about what your opinion is of that, their early results, and how long away do you see actually convalescent plasma actually being in use as a potential treatment here?
Well, I think there are many treatments currently in trial, and convalescent plasma is one. And I know that there are efforts underway in Canada doing that research, whether it's involving the Canadian Blood Service and Héma-Québec. I know that there are efforts underway. And so they have to be done in the context of well laid out studies, of course. So I know that they're underway. I cannot tell you exactly when they'll be completed, but I think we'll keep people informed. And
Minister Miller, can you talk about the case in Nunavut that you mentioned today? So how did that get into that community? How is it that the virus was arrived there? There's so much of a closure around Nunavut. It's hard to understand on a week when you seem to be giving us good news that that's such a terrible piece of news to hear.
No, thank you, Tonda. We are currently, since it is very much a recent development, we're in the initial stages of tracking and making sure that all the measures are taken to stamp out it. The communities have been doing, at least those that have had a relatively low number in remote communities in particular, have instituted pretty strict guidelines to arrest and stamp out as they come in, and with very, very positive results. So, as a number of our public health officers have said, this is a disease that knows no borders, although there are measures that can be aggressively taken to stamp it out and arrest it when it comes in. I would, again, since it is so new, I'll let Tom speak to the specifics of it to the extent we can disclose it. But again, it is so relatively new, and we're just gathering the information and make sure there's aggressive tracking in place to contact anyone that's been in contact with this positive case. So we'll get that information to you as soon as it can be disclosed, but Tom will speak in more detail to it.
Working together with the Public Health Agency of Canada, we support the Nunavut Health Department. Nunavut Health Department is the lead department in order to identify the source of this infection and investigate contacts. Should that be needed, we will assist Nunavut Health Department in both contact tracing as well as epidemiological support, as well as public health measures.
Mike?
Good evening, or good afternoon. Mr. Duclos, businesses have told us about this new commercial rental help stuff, that the program isn't working because either they're not eligible or they're unsure that their landlords will support them, or they're not being communicated properly. And we talked to a guy in BC who's got a furniture store and he's burning through his rental savings to keep going. This is questions from him, and he wants to know, why wasn't this whole thing legislated to be mandatory?
Well, that's an excellent question, and I would signal that this is not only something very important that we're trying to do, but also something very collaborative. As we know, the relationship between landlords and renters is mostly guided by provincial jurisdiction and provincial responsibility. And that's why it was very important from the start to do this in collaboration with provinces and territories, to find the best way, the most efficient way, the most rapid way to channel that help, in particular to smaller businesses. So those businesses are going through very difficult times, although the wage subsidies are going to help them in many cases, although the emergency loans, the 40,000 loans, also will be helpful to them in many cases. We understand that there are fixed costs, and many of them are related to rent that cause them a heavy burden. So the arrangements were designed and will be implemented with the collaboration and in many contexts, many ways with the leadership of provinces and territories. Now, these things, as we've seen over the last weeks, will often evolve. And that's why we keep listening to the concerns, to the particular conditions of small businesses, in particular across Canada, while engaging with provinces and territories. We're going to make sure that what has already been announced will be implemented in the fastest possible way. And we also, as I said, we all look forward to continuing not only that work, but that discussion and conversation with small businesses in particular.
And I would just like to echo that. We have a First Minister's call. The Prime Minister has a First Minister's call with all of the premiers and provinces of territories later today. This has become a weekly event. The commercial rent support was discussed last week and the week before. And it is actually, I would say, an example of the incredibly effective collaboration of Team Canada that the federal government, the provinces and territories, and landlords were able so quickly to put this huge support in place. This is 75% off your rent. And I would remind people that it comes on top of a vast wage subsidy program, which these businesses, many of them, should be eligible for, and also on top of the business loan program, which is in place. Taken together, all of these programs are by far the largest economic support action that a Canadian government has undertaken in Canadian history. Now, I totally, Mike, understand the profound anxieties of Canadian businesses and of all Canadians. This is a really, really difficult time. And as Jean-Yves said, we are very thoughtful about putting programs in place as fast as we can and being open to figuring out how they are working as we go along. But for you and for Canadians, I would just like people to step back a little bit and also see the magnitude of what has been put into place with, I would say, all levels of government working together and also landlords playing a role here.
And well, today is rent day. This is the day. We all know it. But so businesses that they're in that non-eligible range, or they're trying to figure it out in the next 24 hours. What can they do, or what should they do to get through till tomorrow?
They should be, and I'm sure they are, in conversation with their landlords. I think landlords are keen to keep their tenants in place, and I would encourage Canadian landlords to also act in a responsible way, in a way which is supporting fellow Canadians, is supporting the economy, and which is preparing all of us for a restart. They should be also in conversation with their banks, and the Canadian banks have been very much a part of the programs that the federal government and provincial governments and territorial governments have put in place at all levels. And of course, they should be in conversation with the government to see which programs they can get support for. I would also say get in touch with your MP's offices. I think 3 of us here are also constituency MPs, and my office definitely devotes a lot of time to working with the businesses in my riding and helping them to figure out what they're eligible for. Jean-Yves, est-ce que tu veux ajouter quelque chose?
Did you want to add anything, Jean-Yves?
First message you delivered, Christian, is very important. I think a conversation with landlords is absolutely essential. If I put myself in the position of a landlord, I would be looking not only at the short-term rent I may be getting, but also as to the long-term possibility of retaining my renters. And we're all together in this particular crisis. We all need to help each other. And I think landlords will want, and I think most of them are already doing that, will want to think carefully about how they will treat their renters in the weeks to come.
Thank you, Minister. We have time for 2 more questions on the phone. Operator.
Thank you. Merci. La prochaine question est de Louis-Samuel Perron de la Presse canadienne. Votre ligne est ouverte. Your line is open.
Oui, bon.
Good afternoon. First, I work for La Presse. A question for Ms. Freeland. In terms of firearms control, are you going to provide legislation this week with changes to regulations that are official? Answer. Our government, even before the very tragic events that took place a week ago, during our election campaign, made arms control a very important component. We all see that increasing firearms control is essential to protect Canadians. And I am certain that Canadians agree with us. We stated this during our election. We're absolutely, well, this is a measure we support. We're going to do it. The Prime Minister has said on many occasions that he's in favor of this, but in terms of the specific dates, I can't tell you that today, but I'd like to reassure you that this is a measure that we believe very firmly in. It's important for our society, and we have to do this now. It's not an issue that we can wait on. Follow-up question? A question for Minister Duclos. In terms about the $250 billion in debt that could be racked up in 2021, are you concerned about these debt levels? Is there maximum ceiling that the deficit could reach? Answer: we don't have the means to not take the means to directly deal with the current situation. Obviously, we will know in a few weeks that we'll be in a recession, not just Canada, but other countries as well. This recession, if it turns into a depression, we'll have to act quickly. And Mr. Trudeau and Minister Morneau have also reminded us that we're going to do everything in our power to protect our economic and social situation during this crisis. This will be temporary if the government to do what it should to intervene quickly to solidify the conditions of workers. And in thousands of cases, they have nothing to put on their tables. But we have to provide support to workers in Canada. And we also have to provide support to SMEs rather. So the Canadian government cannot skimp. We know this is an emergency situation. And since it's temporary, and if we want it to be temporary, we have to take the means necessary now. Last question.
Thank you. Merci. La dernière question est de Marie Vasseur.
Last question from Le Devoir.
Oui, bonjour.
Good afternoon. My question is for Ms. Freeland. Once again, about your election promise to ban military-style assault weapons. When, in terms of the date, when do you plan to act? And do you think it is possible to ban military-style assault weapons in Canada before you have a buyback program in place like you promised to do to accompany this measure? Answer: I would just like to underscore that this is a priority for our government. I think that everyone understands that with the COVID-19 crisis, this has somewhat changed our plan for spring. And it's obvious for all Canadians that with the COVID-19 crisis, our priority has been saving lives in Canada. But even before the election, one of our priorities was to control firearms. We're going to do this. I can't give you a specific date today, but I can assure you that we are going to do this very quickly. I don't think we can wait. It's also a question of Canadian lives, and we do have a mandate from Canadians to act and to take measures, and we're ready to do so, and we're ready to act quickly. I can't give you specific details about programs, but I can assure you that Minister Blair has worked on this file quite a bit, and we're ready and we're going to act quickly. Follow up? Well, you just gave my colleague the same answer, but that wasn't really asking that. I wasn't asking when you're going to take action. I wanted to know, given that if you need a buyback program for this military-style assault weapon, you would need a bill. I don't think that's possible right now, since the House is only sitting exceptionally for COVID-19. So if you want to ban military-style assault rifles, how can you do this if you don't have a buyback program in place? And if you do have one, what are you doing aside from promising to ban weapons? And I don't think you plan to do this quickly because you don't have a buyback program in place. Answer: thank you for your question. I understand very well your question. And thank you for your understanding of what's at stake here. and of the legislative situation. Today, I can't give you specific dates. And I also can't tell you exactly how we're going to do this. It's a good question you've asked, and I can assure you we've given this thought. And today, I can only assure you and Canadians that we do have an action plan, and we are going to act very quickly. And I can also tell you that I think that the elections showed that Canadians are in support of this. And we did receive support from a majority of MPs that support these measures.
So I cannot share details today about the exact timing of our government's plan to act on gun control. What I can say is that our government is firmly committed to acting on gun control. This was one of the key planks in our election campaign, and we received a strong mandate from Canadians to act on gun control. This was our intention, and it is our intention. I'm not going to today be able to give you details on exactly when we will act, nor can I give you details on exactly what steps and the order in which we will take the different necessary measures. But let me just say, this is an absolute priority for our government. It has been for some time. I really believe, and I felt as someone, on knocking on doors during the election campaign, this is something Canadians are ready for and they want, and we are going to deliver very soon.
Thank you. Ceci met fin à la conférence de presse.
This ends our press conference for today. Thank you.
Thank you.